Hi, my name is Bruce Crispin, and I'm the director and founder of the Esthetic Professionals Dental Education Center in Tarzana, California. And today I want to introduce you to kind of a new concept and a new technology that we've developed to really assist you in your patient management. Typically, when we're dealing with our private practices and we have to work on posterior teeth, and we need a limited amount of, we have a limited amount of room, typically what we do is we use a mouth prop, we wedge it between the patient's teeth, to hold their mouth open. What we've developed is something a little bit different. So typically we have a mouth prop, we put it between the patient's teeth, we wedge it in there, and a few things happen. Number one is because it's kind of wedged in there, and if the patient, has some muscle tension or muscle pain, you end up taking it in and out a lot because they can't tolerate it. And that certainly leads to more chair time, which is not a good thing. The other potential problem is when you wedge something between their teeth, and if you look at this typing on, you have the potential to subluxate the mandible. Okay, and when you start subluxating the mandible, you can get muscle tension, you can get some other potential problems related to that. And another thing that you may encounter is when you go to adjust your provisionals or adjust your final restorations, the patient's muscles are tense, maybe their joints might be a little tired or fatigued as a result of having this kind of wedge between their teeth, and it may lead to, again, increased time of adjustment or maybe not adjusting the restorations or provisionals properly. Now, in contrast, we've developed just a very simple new concept, a totally new concept called the Helping Hand. Now, one of the cool things about this is the patients have complete control, so they still can open and close their jaw a little bit. If they get a little bit fatigued, they can take it in and out of their mouth easily. And what we've really found is that the patients actually use these longer. They hold their mouth open longer for more extended period of times. Oftentimes, even open their mouth wider. And because they have the control to move their jaw in and out and take it in and out themselves, it really expedites the treatment process and minimizes the potential problems. So the Helping Hand was designed very simply just to hook over the lower teeth, and then the patient will lay there, little hook to hold with their lower hand. They lay this on their chest, and we'll demonstrate that in a minute. But now they can open up their jaw, and when they open their jaw, it doesn't subluxate the mandible. It actually pulls it from the front. It keeps that TMJ in a hinge position. And again, what we found is it minimizes the potential to have muscle pain or possibly joint pain and fatigue as a result of, in contrast to having a mouth prop, which is more like a wedge. So now we're going to demonstrate really with a patient how we can position and use the Helping Hand jaw retractor. As we mentioned before, when you're using a traditional mouth prop, when we position in the patient's mouth, they have to bite on it and kind of hold it together. So they have to actually flex their muscles, hold it together. Again, the potential to have some muscle fatigue and problems. Another problem that we have with mouth props that have these little flanges on them is that sometimes when the patient positions it way in the back of their mouth, it hits the thin mucosa over the bone, and as the case we just had right now when we were testing this, it pinches into the tissues. Now, they can be modified, obviously, but maybe there's a better way to do this. Another thing that you have when you put this mouth prop in, it's kind of a unilateral thing. So the patient's biting here on this side, and it kind of torques the jaw on the other side where there isn't any support. So you have obviously unilateral support. In contrast with the Helping Hand, the patient is controlling this. When they open up nice and wide, you can see position the hand. They can put the whole hand in this little hook. They can put a couple fingers, whatever is comfortable. And when they open up wide, we've designed this so the hand should be kind of resting nicely on the chest. Okay, so the patient can essentially sit there comfortable or lay there comfortably. and not have to hold their hand up. Now, if their hand is up a little bit for whatever reason, take your other hand. You can actually put, no, just give me one hand. They can actually put one hand and put the other hand and kind of prop it up a little bit. So you do have some variation, but it's designed really so they just kind of rest on their chest. If you need a little more support, they can use their other hand. Okay, so go back to how you work. So normally what we do is if we're working on the back teeth, we would have them open up. And again, because they're in control, we really have found the patients will open up wider and longer because they can open up and close a little bit. They're not intimidated by the fact their mouth is wedged open, and so they are in a little more control and they can hold it open wider for longer. So now we have plenty of access in these posterior areas to do whatever procedures we want. If we need to work further forward, we can always go ahead and let me just reposition this. You can go around to the side if you need to. Okay, so if you're working in the front, you want to work more in the bicuspid region. You want a little more access. You can move it, right to left, and so really there's a lot of variations in how that you position this. So I think that the main thing is really the patients have a lot more comfort. They have a lot more control, and during your treatment process, your prepping and whatever procedures you're doing intraorally, it really makes it faster for you, which is a good thing for your bottom line, and the patients have a much more enjoyable experience, and I think everybody wins. So it's really kind of a win-win situation for everyone. Okay, another nice. Okay, go ahead and open again, nice and wide. Another nice advantage of the helping hand is when it's holding the jaw open, you're getting kind of uniform bilateral kind of pull and stress on both sides. It's kind of evenly distributed. We've already mentioned the joints not being subluxated, as opposed to a mouth prop where it's kind of a unilateral thing. So we're getting nice balance, less fatigue, and really some enhanced patient comfort as a result of kind of holding it in the front rather than wedging it from the back. I hope after seeing this short demonstration video that you can really understand the benefits of the helping hand versus our traditional alternatives. And I hope you in some way are excited about it as we are. And I can tell you, we've done surveys with our residents. My daughter and I have used it in our clinical practices for approximately a year now. And the feedback we're getting from patients has been very, very positive. And in fact, patients will actually come in and ask for a helping hand during their dental procedures. Additional point I'd like to mention about the helping hand, this wasn't a design that just came out of the sky and we made a bunch of these and hope to live happily ever after. It's actually gone through several different prototypes, and it was engineered and designed to really be very ergonomic for both the patient and the dentist. And so we've gone through a number of different designs. We've tested those designs clinically, and really we've come up with what we feel is a very clever and useful and well-engineered design for this helping hand. If you're interested in finding out more about the helping hand, just contact aesthetic professionals, and the contact information should be listed below. Okay, thank you.